beloved family pet or your furry kid with labored breathing and having difficulty playing and exercising or becoming very lethargic, or learning that your ignorance about heartworm prevention could have put them in harm's way. Heartworm disease is a silent killer. According to the American Heartworm Society, heartworms in dogs have been diagnosed all around the globe. Symptoms do not typically appear until the disease is more advanced. Heartworm disease can cause breathing problems, heart failure, and even death. I'm going to inform you about heartworm disease in dogs. I've worked in the veterinary field for 7 years, so I'm very familiar with heartworm disease. I'm familiar with its symptoms, its treatment, and its prevention. Why are heartworms bad? Symptoms can include coughing, distress breathing, labored breathing, and lethargy. These symptoms don't normally appear until the heartworm infection is in more advanced stages. By this time, there's already a lot of damage done to the dog's heart. Heartworm disease is transmitted when a mosquito bites a dog and releases heartworm larvae into the bloodstream. This larvae is called microfilaria. The microfilaria makes its way to the dog's heart, where it sets up its home. So you can see here, the heartworms inside the heart. The amount of heartworms accumulating in the heart fills its arteries, its right ventricle, and its right atrium. This interferes with the valvular function and the blood flow. This restricts the heart from functioning properly and ultimately restricts it from doing its job. As stated by the American Heartworm Society, heartworm prevention requires authorization by a licensed veterinarian having a valid relationship with the client and patient. The prevention of heartworms is simple. Most prevention consists of doses given either by oral administration, topical administration, or injectable administration. Oral and topical administration is given every 30 days. Injectable administration is given usually every 6 months because it's a slow release. Currently used preventions contain the drugs ivermectin, milbemycin, moxidectin, and salamectin. And these are the ones that you will most commonly find in heartworm preventions today. As stated by local veterinarian Dr. York of Claremore, cost of prevention far outweighs the cost and dangers of treatment once your dog is already infected with heartworms. It's also important to know that you need to test your dog before you put them on prevention. Putting a dog on heartworm prevention that is already heartworm positive can be very dangerous. It can put them into, breathing distress, and they can have a lot of reactions. In order to test your dog, you can do what's commonly referred to as a snap test, a blood snap test. You draw about 3 drops of blood, and it takes about 3 minutes, and it will tell you if the dog is negative or positive. A radiograph and an echocardiograph are a little more extensive forms of diagnosis. They can show you a little more about the changes of the heart that has begun because of the heartworms. And then, of course, there's also a blood smear test where you take a drop of blood and you put it under a microscope, and you can actually see the microfilaria swimming in the bloodstream. There's a couple of different options for treatment. No matter which route you take, treatment can be expensive, it can be stressful for your dog, and it can be very dangerous. One widely recommended form of treatment includes an injectable dose of miticide given 2 consecutive days. Treatment is not always successful, and death can occur during treatment. Usually how this happens is the owners let the dogs become too active within the month after the amiticide injection. And what happens is the worms in the heart, they can actually break apart and they can get lodged in different areas of the heart. And that, of course, can cause the heart to not function correctly and can cause death. So in conclusion, testing for heartworms is simple and treating heartworms is not. So prevention is always the best recommendation. Most veterinary clinics can administer an in-house blood test for heartworms, and it requires minimal blood, takes minimal amounts of time. And once your dog tests negative, you can get your dog started on a monthly prevention and protect them for their life.